All right, if you're prepping for the NCLEX, you know fluid and electrolytes are a huge topic. But honestly, nailing these questions usually comes down to one thing, really understanding the difference between fluid overload and fluid deficit. So in this explainer, we're going to break it all down, super simple, so you can walk into your exam and onto the floor, feeling confident.
So here's our game plan. First, we'll cover the basics, the balancing act. Then we'll do a full head-to-toe assessment looking at the physical signs. After that, we'll peek under the hood at how the body's systems respond. Then we'll decode what the blood work is telling us. And finally, we'll hit the single most important vital sign you need to be watching. Let's get right into it.
You know, at its heart, the human body is all about balance. It's always striving for that sweet spot called homeostasis. So I want you to picture your body's fluid level like it's on a scale. When things are good, it's perfectly level. But when that scale tips too far in one direction or the other, well, that's when we get into trouble. And that trouble comes in two forms. On one side, you have fluid volume overload, or hypervolemia. That's just way too much fluid in the tank. On the other side, you have fluid volume deficit, or hypovolemia, not nearly enough fluid. They're total opposites, and as you're about to see, they look completely different in a patient. Okay, if you remember one thing from this entire explainer, make it this right here. This is your cheat code. For fluid overload, I want you to picture a big and bulging body. Everything is swollen, full, and just big. For fluid deficit, think low and little. Everything is dried up, shrunken, and small. Got it? Let's burn that image into our brains as we go. All right, your patient's body is basically a roadmap of clues. You just have to know how to read it. So let's start a proper head-to-toe assessment and see what the body shows us, comparing overload and deficit side by side. Starting at the top with the brain. Now this one's a little tricky because both conditions can cause weakness and confusion. So why is that? Well, in overload, all that extra water dilutes the body's sodium, which can actually cause the brain to swell. In deficit, the brain just isn't getting enough blood flow to work properly. So you see the same symptom, but for two totally different and dangerous reasons. Now the cardiovascular system, this is where the differences become crystal clear. In an overloaded patient, their heart is struggling to pump this massive amount of fluid. The pipes are full, you'll feel these really strong bounding pulses, and you'll see those neck veins popping out. That's your classic JVD. But with a deficit, the tank is running on empty. The pulses feel weak and thready, the neck veins are flat, and the heart is beating super fast, tachycardia, trying its best to move what little fluid is left. And listen up, because this is a huge test tip and a real-life safety alert. In fluid volume overload, all that extra fluid makes the blood pressure shoot through the roof. This isn't just a number, okay? This puts your patient at immediate risk for a hypertensive crisis or even a stroke. And the other side of the coin is just as deadly. Low blood pressure in a fluid deficit patient is incredibly dangerous. They get that severe orthostatic hypotension, they stand up and get super dizzy. This makes them a massive fall risk, and patient safety is always priority number one. Let's look at the skin. An overloaded patient's skin is literally waterlogged. It gets puffy and swollen. You can press on their shin and your fingerprint will just stay there. That's pitting edema. A deficit patient is the complete opposite. Their skin has lost its elasticity. It's dehydrated. You can gently pinch the skin on their forearm and it might just stay up in a little tent. Their mouth will be dry, their lips chapped, and their eyes might even look sunken. Okay, so we've seen all the signs on the outside. Now let's pull back the curtain and see how the body's internal systems, we're talking lungs, gut, and kidneys, are trying to cope with this imbalance. In fluid overload, the lungs are in big trouble. All that excess fluid backs up and starts filling the lungs. This is pulmonary edema. They're literally drowning from the inside out. When you listen with your stethoscope, you'll hear those distinct crackles. In deficit, the body's just trying to conserve energy, so while their breathing might be rapid, it's going to be very shallow. The GI system also tells a part of the story. In overload, everything gets swollen and sluggish, which can lead to constipation. You might even see a bloated abdomen from ascites. Now with deficit, you might see something that seems counterintuitive, diarrhea. But it happens because the body is trying to eliminate waste without enough fluid to form solid stool. And the kidneys? They give us some of the clearest signs. When the body is overloaded with fluid, the kidneys work like crazy to get rid of it, so the urine is very clear and dilute with a low specific gravity. But when the body is dry, the kidneys hold on to every single drop of water they can. This makes the urine really dark and concentrated with a high specific gravity. So just remember, specific gravity is low when the patient is liquidy and high when they're dry.
So the physical signs are critical, for sure. But to get the definitive, undeniable truth, we have to look at the blood work. The labs tell us the real story of what's happening inside.
Yeah. I mean, we can see the swelling and check for skin tinting with our own eyes, but the blood gives us the hard numbers, the data we need to confirm our diagnosis and figure out the best way to treat it. Think of it like a glass of Kool-Aid. In fluid overload, it's like you've added way too much water. Everything gets diluted, right? That's exactly what happens in the blood. Values like hematocrit, BUN, and sodium all get watered down, so they look artificially low. Now, in a fluid deficit, it's like you didn't add enough water. The Kool-Aid is super concentrated and strong. Same thing with the blood. With less water, everything becomes more concentrated, so those same lab values are all going to look high. And that brings us to our second amazing memory trick. This is another golden rule for the NCLEX. Just remember this simple phrase. Lab values are high when the patient is dry, and they're low when the patient is liquidy. High and dry, low and liquidy. That little phrase will help you answer so many questions correctly. Okay, last but certainly not least, let's talk about what is, without a doubt, the single most sensitive indicator of a patient's fluid status. It's not their blood pressure, it's not their heart rate, it's their daily weight. If your patient gains 2 to 3 pounds in a single day, that's a massive warning sign. Nobody gains that much fat in 24 hours. That's not food, that's fluid. It means they're retaining a lot of water. And an increase of 5 pounds over the course of a week, that's a huge red flag. That kind of fluid gain is something you need to report to the doctor immediately. So the bottom line is this, especially for our at-risk patients, like those with heart failure or kidney disease, rapid weight gain is water gain, period. It is the most direct, most reliable way you have to track what's going on with their fluid balance every single day. We have covered so much today, from head-to-toe signs all the way to the lab values. So I'll leave you with a final question to think about. Of all the